Gauteng continues to be the epicentre of the fourth wave in South Africa. People in their 30s are the worst affected this time around. Gauteng reported 16,700 of the just over 18,000 cases reported countrywide last night. So let's unpack this with public health medicine specialist Dr. Harsha Somaroo. Thank you so much, Doc, for your time, and good morning to you. Now, with Gauteng being the epicentre, what does this tell us about, the infection rate, but also about this variant and what it's currently doing, its impact within the province of Gauteng?
Hi, good morning, Tamela. So, I think at this point in time, we've seen a high level of COVID transmission in Gauteng. I think we entered the fourth wave in the province on the 1st of December, and since then there's been exponential increases in the number of new cases. However, we feel that the number of new cases might be steadying at the moment. Obviously, this week is critical to monitor to see what happens. But early indications are hopefully we will be reaching the peak of this wave soon. Obviously, that does depend on many factors. The one thing that is being considered is the background immunity. I think there might be a certain degree of natural immunity with the additional immunity confirmed by a vaccination in the population. So that might be assisting to kind of counteract this very, very highly transmissible Omicron variant. However, the other things that are important are the behaviors of people in Gauteng. I think we know that this virus can only be transmitted from person to person. So if people actually restrict those interactions, that's also going to contribute a lot to decreasing transmission.
Yeah. Doc, we know that around this time in December, particularly this week, it's when most, companies are closing, most people, residing in Gauteng, but, have, homes in other provinces do travel a lot. So with that being said, are there concerns that with the expected, interprovincial travel, we might see these numbers actually moving from Gauteng and therefore, COVID infections increasing in other provinces as well?
Yes, I think at this point in time, the Omicron variant is prevalent in most of the provinces, and we've seen other provinces enter the fourth wave as well. So I think with the increased interprovincial travel, this might impact it slightly, but we've already seen an increase. I think what is important is for people are traveling, that they travel safely, and adhering to those behavioral recommendations will be critical. For example, avoiding large gatherings, making sure you wear a mask in public, making sure that you keep a distance from other people, and so on.
Yeah. Perhaps with that being said, give us, a perspective or even just some insight into how hospital admissions actually are looking like within Gauteng, though, at this particular time, because we do know at this stage Gauteng is the epicentre. But do we see that also reflected in hospital admissions due to COVID infections?
Yes, certainly. I think there has been a rise in hospitalizations over the past few weeks. However, the rise has not been in keeping with what we saw in the previous wave at that number of cases. So we do expect a rise in cases in the next few weeks as well. Also, the severe illness and the hospitalizations does tend to lag behind the case numbers by 2 to 3 weeks. So we do expect an increase in the case numbers as well. I think last week we saw a 150% increase in the number of cases. However, when we compared it to the point in time when the third wave, we were significantly better off because the numbers were a bit lower and the patients were experiencing less severe illness. However, it is a concern that if the numbers do increase to a large degree, that the admissions will follow as well. I think as a lower percentage of a larger number, you're still going to get a high number of admissions. So we do obviously want to make sure that transmission is stopped to impact hospitalization.
Well, Dr. Harsha, we appreciate you speaking to us this morning, giving us, that update with how the province is looking. Dr. Harsha Somaroo from the Wits School of Public Health.